Welcome to The Lens, hosted by Catalysis, where we get a glimpse inside healthcare organizations that are transforming to a culture of improvement to deliver continually higher value outcomes for patients, staff, and communities. Visit createvalue.org/The Lens for more information about Catalysis.
Welcome back to The Lens. I'm your host, Peter Mariahazi. Today, I'm joined by John Toussaint, founder of Catalysis and co-author of Becoming the Change. This new book offers leadership strategies for continuous improvement in healthcare. John, thank you for joining us today.
Nice to be with you, Peter.
So please tell us a bit about why leaders' behaviors are so fundamental to beginning an improvement culture.
Well, we all know that culture is really related to behaviors, and that leaders actually are the ones who decide what that culture is going to be, and they do that by modeling the behaviors that are expected, or that are what the leaders feel are going to change the organization. And we know that there are specific behaviors that are important from the standpoint of building a continuous improvement culture. And I think that's the point here, is that if we as leaders are really serious about building that improvement culture, then we're the ones that actually have to make those changes.
You know, that's tied into a lot of podcasts we've had. So what are those most important behaviors you reference for executives to model, to build that culture, to set the standard and show the way?
Well, we've defined 5 what I would call behavioral traits or behavioral dimensions, but then there are specific observable behaviors behind each one of those. So let's walk through that. The first one is willingness, and that means willingness to change one's own approach or actions. And one of the ways that we would know whether an executive is actually willing to do that is that we would have specific evidence in their calendars, for example, that they're taking time, not in the shower or not driving to work, but actually taking time in their regular work schedules to reflect. And I like to ask, 2 questions. What did I do this week that unleashed the creativity of my team, and what did I do this week that shut them down? And if we can reflect on those 2 questions and we have that in our calendar, then that's observable. The second key behavioral trait is humility. And so we know, and there's a lot of good evidence in the literature, that humble leaders actually have better results from an organizational perspective. That's been shown for many years. Actually, Jim Collins wrote about that way back in 2005. So the question is, what would we observe if we were observing leaders leading with humility? And one of the things we would observe is that, first of all, they go to the place of work go to the place where value is created in the work, go to the front line and ask open-ended questions, not questions related to, that have their solution embedded in them, but questions that help to people to maybe think differently, and also to learn what's really going on at the Gemba. The third key trait here is curiosity, and that's an interesting one. It doesn't necessarily show up in leadership books, but we know if you're going to build a continuous improvement culture, you really have to care about what's going on in your organization. And the way that we would observe that is, are you actually asking open-ended questions? Are you empathetically listening rather than just waiting to talk? And are you using some kind of method? We suggest sort of A3 thinking method, which is staying on the left side of the A3, not jumping to conclusions, but going to the Gemba and asking these questions to try to deeply understand really the current state of any clinic or department or any place that you're visiting. The fourth one is perseverance, and the way we might observe this is: are you persevering to the point where you have a coach, you're getting some feedback from a buddy? That's what we suggest, is that there's somebody that's observing you and then giving you direct feedback about how your behaviors are affecting people. And then the fifth one is self-discipline. And of course, this tends to be where a lot of executives have gaps. And so the question is, can I observe anything that way? And what I would observe is do you have leader standard work? Is there anything in your calendar which is standard and actually adding value to patients? So we do. When I was CEO, I reviewed my calendar for the next week. My coach said, just ask yourself, is anything you're doing actually going to add value to your patients? And when I looked at my calendar and found that in the whole week, the answer was 0. All my meetings, all the activities that I had planned actually were not going to be value added. So unless you build value added standard work into your calendar is going to get filled with non-value added activities. So you always have to keep that in mind when you are thinking about this idea of building self-discipline within your day and your week.
So with those traits, one of the hardest things for anybody is self-reflection. And so how does the team of executives hold each other accountable and keep an eye on each other to help each other in day to day to continue that development process?
One of the most important aspects of this, and I like the word responsible rather than accountable. I hear the word accountable all the time. And to me, that means that, sort of top down, you're not doing what I told you to do. But if we hold each other responsible, that's a different type of way to get work done. And it starts with us agreeing to how are we going to treat each other? And what are those key behaviors that we're going to agree that we all are going to model the way for? And if we've actually established that as a team, then we can call each other out, whether you're the CEO or the finance director or whatever, and that should be part of the discussion at the senior level is, please, if I'm not acting the way that we all have agreed to, call me out on it. And I think, the example that I use is Eric Dixon at UMass Memorial. He's an emergency room physician and the CEO there. And with his team, he basically said, I'm a trauma doctor. So when I get in my trauma mode, I'm going to direct people. But when I'm in my CEO mode, that's not the right way that's not the right behavior to model. So if I get into the trauma doctor mode during meetings or when I'm, actually in a management situation, you need to call me out on that, because that's not the right behavior that we expect out of our executive team. And so it's really important, and they do, and I've actually seen them do that to him, and it's perfectly fine, because they've created this space that says, if I'm acting in this way, you are absolutely not only okay, but I want you to call me out.
So it's an expectation, and thank you for that clarification on terminology, because we talk about words matter, right? The difference between accountability and responsibility is very important. So how do the executives learn these behaviors? How do they take it to the next level and start working on them and learn them and go from there?
Well, this is one of the reasons we've written this book, Becoming the Change, is it gives people examples of others who have actually gone down this path and begun to model the way for their own organization. But frankly, I've worked with executive teams all over the world, and many of them. And I've really not found any that could just do it completely on their own. They really required some level of coaching to understand, really, they didn't know what they didn't know. And that was true for me 20 years ago as well. And so unless you commit to some kind of coaching process, whether that's internal or external, I think it's really difficult to make these changes, because it does take perseverance, and it does take expertise that you don't have necessarily to make some of these changes happen. And so, we're a big believer that identifying a coach, and then identifying also a mentor, which is different than a coach, right? So a mentor is somebody you can cry on their shoulder, whereas a coach is actually going to be giving you feedback and helping you down this path of building these important behaviors, and then learning how to model those behaviors in a way that is going to really cascade throughout the organization.
And that ties to, as you said, the willingness and the humility to accept that and understand that you've got to develop. And so you've mentioned the mentor, the coach, the peers, and the team providing feedback. How else can they get some feedback? I mean, you've talked about setting aside time for reflection as well.
I think that those that are listening to this podcast that are familiar with A3 thinking, we actually have built a process, and you can actually download the templates of that from the book Becoming the Change, on how to use a personal A3. So we always think about A3 as problem solving or strategic, but you can also use it as a personal development activity. And so what it is really a self-reflection. It's a deep self-reflection process. And when we introduce the personal A3, which is really about your own behavior and habits, it becomes a living, breathing document for you that you want to revisit every couple months, and you want to reflect on what I've learned and what is working. What are the experiments that I've run, that and why am I running those experiments in terms of my own actions and habits and behaviors, and what have I learned? And then let's try some other things, if I'm not actually making the progress that I want to make. Now, with a personal A3, you do need to have some kind of feedback mechanism. And, some teams, like Eric Dixon's team, are willing to give him feedback. I've certainly worked with other teams where the executives are not that comfortable with giving the top person feedback, or, subordinates giving their bosses feedback. So in that case, which is, I would say most cases, you need another mechanism. And that can be, for example, an internal PI coach, if you give them that power to give you direct feedback. It can be an external coach, like we talked about. It can be a buddy, so someone that you've anointed, who's a trusted colleague, who can tell you what they saw. For example, I've seen these trusted colleagues, write down the questions that you ask at the Gemba. And then, you can get some reflection from the buddy on the questions you ask. Were they what and how questions, or were they who and why questions? Obviously, we're looking for what and how questions. So you have to figure out for yourself, what's the best way to get feedback. And then you have to build that into your reflection process. And I would suggest the personal A3 is really the most powerful way to sort of hold yourself responsible for the changes that you've already committed that you want to make.
Fantastic. John, are there any final thoughts you'd like to share with our listeners on this? It's important self-reflection and development.
Well, I think one of the things we've learned over this many years now that we've been students of the organizational excellence / lean game is that it really starts with behaviors. And most of us grew up with tools, and the tools are great and you got to learn them and you got to know how to use them. But if we don't have behaviors that are based on a set of principles, so again, we have to identify key principles to our management philosophy. We, of course, have been espousing the Shingo principles, all 10 of those as a way to get started. But you have to define the principles of your management philosophy, which then actually helped you to understand what the behaviors are that you're going to need to begin to model. And then you can build systems that reinforce those behaviors and then use tools to get results. But if we don't start with the principles and behaviors first, we just don't sustain the game, and we don't build a culture of continuous improvement.
It really doesn't become part of the DNA, does it? It's not, doesn't stay with you.
Right.
John, thank you for taking the time to talk to us today.
My pleasure.
And thank you all for listening. Please visit createvalue.org to learn about the Lean Healthcare Transformation Summit in June and this book, Becoming the Change. Stay tuned for more episodes designed to help healthcare leaders support their organization on journey to organizational excellence.
Thank you for listening. Visit createvalue.org/thelens to learn more about how Catalysis can inspire you to accelerate change in your organization.